Hello and welcome back to the ECG course. This is chapter 7. In this chapter, we're going to talk about sinus rhythms. Okay, we're going to quickly review again the electrical conduction system. We talked before about this little guy right here in the right atrium. That's called the SA node, or sinoatrial node. And that's your pacemaker of life in most healthy individuals. You know, it sends out a signal 60 to 100 times per minute. Hopefully, the rest of this Bachmann's bundle here and these internodal pathways here will conduct that signal through cellular depolarization. Okay? And then it'll pause right about here. This is called the AV node right there. It'll pause and it'll allow the atria to completely eject all of its blood, because hopefully you're having atrial contraction, into the ventricles. And then that conduction will continue down through the AV junction here into the bundle branches. This is the right bundle branch. This is the left bundle branch. And then you have your little Purkinje fibers off of those. And then you'll have ventricular depolarization. We said atrial depolarization comes from the P wave, the P wave is signifying atrial depolarization, and the QRS complex lets us know about ventricular depolarization. So let's use that information we know. So a normal sinus rhythm, you're going to see this rhythm very, very often. Most people are in this rhythm every day, and again, the rate is 60 to 100 beats per minute. 60 to 100 beats per minute. Because what we're saying with a normal sinus rhythm is that the pacemaker is the SA node. So with a normal sinus rhythm, your pacemaker is right here. It's the SA node. You haven't had anything cause any issues. You haven't had any ectopic foci causing a new pacemaker or anything like that. You're just having your normal SA node causing the atrial depolarization. And it's really an assumption. You don't truly know that, but all of these things have to be true. You have to have a rate of 60 to 100 beats per minute for it to be a normal sinus rhythm. It has to be regularly regular. And again, we know that by measuring the RR interval. So you would take your calipers or a piece of paper and you draw a line on the first R wave, and then another one on the next R wave, and you would measure that out and make sure it stays consistent throughout the entire EKG. You will have variations. I mean, this could get longer or shorter over time, but if it happens from beat to beat, then it's not regular. Your P waves must be present for it to be a sinus rhythm. Your P to QRS ratio, meaning for every P wave, okay, how many QRSs do you have? And it needs to be 1 to 1. So you have a P wave here, you have a QRS here, P wave here, QRS here. 1 to 1. There's no extra P waves, no extra QRS complexes. All right, that must be true for it to be a sinus rhythm. Your PR interval has to be normal. Your PR interval has to be normal. Now, again, the PR interval to be normal needs to be less than 200 milliseconds or 0.20 seconds, which is one big box. So you would look at the bold line box, okay, and you would try to start at the very beginning of the P wave. This is the closest one we got here. And you could see that this PR interval is well within limits. The QRS width must be less than 120 milliseconds. Now, for that to be true, QRS complex needs to be narrower than 3 small boxes. And this one is just at the edge of that limit. If you look, the QRS complex begins at that Q wave right there and ends at that ST segment right there. And it is just at 3 boxes in width. So all of those things need to be true for this to be considered a normal sinus rhythm. Our next arrhythmia we're going to talk about is what we call sinus arrhythmia. Now, sinus arrhythmia typically means, if you broke down the word, that it's sinus, it's coming from the SA node, but it has no rhythm. Arrhythmia. It's not rhythmic, as in regular. Okay, so the rate needs to be between 60 and 100 beats per minute. Okay, 60 and 100 beats per minute. This one, the rate is 1, 2, 3, 4, 5, 6, 7, 8, 9. It's right at 90 beats per minute because this is a 6-second strip. The rhythm varies with respiration. Okay, as the patient breathes, you have a variation in the actual rhythm, the regularity of it. The P wave must be present. Okay, and you should have a P wave for every QRS complex. No extra P waves, no extra QRS complex. Every P wave has a QRS complex, and you can see that's true. The P waves look different than they did before, but you have a P wave here, QRS here. That's a P wave, that's a QRS complex, P wave, QRS complex. So it's 1-to-1. The PR interval, again, it has to be a normal length, and your QRS width also has to be normal, which is less than 3 small boxes. And you could see, obviously, this is very irregular. If I did my little measurement here, you would see that it's regular here to here, but then you have a prolongation, okay, and then it'll come back down, and then it'll continue in a pattern like that and be a little irregular. So that's the big difference. A sinus arrhythmia is the same as a normal sinus rhythm, except it's irregular. The next arrhythmia we're going to talk about is sinus bradycardia. And sinus bradycardia is the same as normal sinus rhythm, except for the first rule, the rate. The rate is going to be less than 60 for a sinus bradycardia. So if you look at all these rules, we have a rate of less than 60. The rhythm is regularly regular, just like a normal sinus rhythm. The P wave is present. Your P to QRS ratio is 1-to-1. For every QRS complex, you have a P wave, and for every P wave, you have a QRS. Your PR interval is normal. All right, you can see it's less than or shorter than 0.20 seconds. And your QRS width should be normal, okay, which would be less than 3 small boxes or 0.12 seconds or 120 milliseconds. Now, just a quick side note on the QRS width, okay, don't concentrate on that alone to determine an arrhythmia. We'll talk about that more later on when we start talking about something called aberrancy. Okay, the next arrhythmia is sinus tachycardia. Now this is a lot like sinus bradycardia, except for it's faster than 100 beats per minute. So we said a normal sinus rhythm has to have a rate between 60 and 100. If it's less than 60, it would be a sinus bradycardia. If it's faster than 100, it would be a sinus tachycardia. Okay, so let's look over this. The rate, greater than 100 beats per minute. If you look at this strip, you've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 times 10 is 120. This would be about 120 beats per minute. It's obviously faster than 100. All right, your rhythm is regularly regular. That is a very important aspect of this. So you have to look at your QRS complexes and see that they map out. Okay, see that they map out. So it should be very regular. And you'll notice your P to P interval is also going to be the same length in all of these sinus rhythms. Alright, so P wave is present. That has to be true. You have to be able to identify P wave for it to be a sinus tachycardia. Your P to QRS ratio is 1-to-1. Your PR interval is normal, just like a normal sinus rhythm, and your QRS width should be narrow. Okay, now just a quick mention about treatment for these patients. Sinus bradycardias, okay, these over here, sinus bradycardias, are usually caused by vagal stimulus. Because your pacemaker is still the SA node, the typical cause for this is an overstimulation of the vagus nerve, which causes the heart rate to slow down. Alright, so these patients typically respond very well to fluids and, if needed, if they're very symptomatic, atropine. Sinus tachycardia is almost always caused by the compensatory mechanism within the body. Okay, so when you see sinus tachycardia, you got to think that maybe the patient has a decreased volume or their container's too big, or for some reason they have a norepinephrine release, a catecholamine release. Okay, so never think that with a sinus tachycardia you have to immediately go to advanced treatments. A lot of times these can be treated very well with just fluids. Okay, next, arrhythmia. Now we're getting a little bit more advanced. Sinus pause, sometimes called sinus arrest, okay? You'll see here that you have a normal sinus rhythm, and then all of a sudden you have this big break, all right? And what they're showing here is where the P wave began, and then where the next P wave should be, all right? And then where the P wave should follow after that. And you'll notice that this P wave here falls outside of that rhythm. So this sinus arrest, okay, actually broke the rhythm. It came back, but it came outside of where it should have. It came after, okay? So the rate will vary because of the sinus pause or arrest. The rhythm is irregular, again, because of the break in the rhythm. The P wave is present except for at the pause. That's why it's a sinus arrest, okay? The P-QRS ratio must be 1:1. If there's a P wave right here, it is not considered a sinus pause or sinus arrest. Your PR interval is still going to be normal, and your QRS width should still be narrow. This is a very uncommon arrhythmia compared to the ones we've mentioned before. Your next one is a sinus block, and it's very similar to a sinus pause or arrest, okay, except it will maintain the rhythm. Okay, so you're going to have one dropped beat, and then your rhythm will come right back. And here's what I mean by that. The next QRS complex should have occurred at that X right there. Okay, and you'll see that if I just take that R to R interval from over here, the normal R to R interval from this rhythm, and I match it up to where that beat was missed, it stays within the regular rhythm. It just missed a beat. So this is different from a sinus arrest. This is a sinus block. Something blocked that atrial depolarization, but it came back. A sinus arrest is different. For some reason with the sinus arrest, the atria never depolarized. This is being blocked. The rate will vary because of the dropped beats. The rhythm is regularly irregular. It will have a pattern, which is also different from sinus arrest. The P wave is present except for the dropped beat. The PQRS ratio must be 1:1. Again, if you see extra P waves here, it won't be a sinus block. Your PR interval is typically normal, and your QRS width will typically be narrow. Okay? So the big indicator of this is that it is a regularly irregular arrhythmia. It'll have some sort of pattern, and when you match this out, or when you march this out, you'll see that it was just a single dropped beat. And you have another one here. And it doesn't always occur in this 3:1 ratio of 3 normal beats to 1 drop beat. It could vary. So we're going to quickly review what we've gone over, and we're going to try to identify these arrhythmias. So let's take a look at this first arrhythmia. And first, let's identify the rate. All right, this is about a 6-second strip here. So we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10 QRS complexes. We're right at the 100 mark. We notice we do have P waves. Okay, we have P waves. That's a good sign of atrial depolarization. We have QRS complexes that look narrow. They're not wider than 3 small boxes. Our PR interval looks normal. Okay, it does not look prolonged, which would be greater than 1 big box. Our rhythm is regular. If we measure this out, it's obviously regular. Okay, same amount of space between these QRS complexes. Okay, from everything we've identified, we have a regular rhythm. The rate is just at 100. It's not greater than 100. We have a P wave for every QRS complex. Our PR interval is normal, and our QRS complex is narrow. This is a normal sinus rhythm. It's also sometimes called a regular sinus rhythm. Let's look at the next one. Okay, again, we see P waves. Now, I want you to notice that these P waves look different. They don't have a lot of voltage there. Okay, they don't have as much voltage, but it's still a P wave. We do have QRS complexes, and those look narrow, although we can't see the small boxes. I assure you they're narrow. Let's check for regularity. See our R to R interval and see if it's regular. Okay, regular, regular. It stays pretty consistent throughout. Okay, let's look at our rate. We have 1, 2, 3, 4, 5, 6, 7, 8, and 9. It's just at 90 beats per minute. Okay, and we have a P wave for every QRS. There's no extra P waves. So from everything we've identified, our rate is less than 100. It's greater than 60. It's at 90. We have a regular rhythm. We have a P wave for every QRS complex with a normal PR interval. And we have a narrow QRS complex. This is also a normal sinus rhythm. Let's take a look at another one. Okay, first let's look at the rate this time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. This is close to 150 beats per minute. Now, just knowing that alone, we know it can't be a few things we already know. We know it can't be a sinus Brady. We know it can't be a normal sinus. What is it? Well, do we see P waves? Now, at first you might wonder if you see P waves, but I will assure you that there are P waves right there. Okay, right there. Now, what might make it easiest to do is find the P waves that stand out the most. So, towards the end of this EKG, I think that that one stands out pretty good, and that one stands out pretty good. And P waves will always march out. So, if you find the highest point of the P wave there and the highest point of the P wave there, and you try to just march it out to find the next one, you know that there's now a P wave probably hidden there. And that will help you find those hidden P waves. You see that there's one there at the bottom of that. If I go this way, I can see that there's one there. And from that one, I can see that there's one there in that artifact. That squiggly line there is just artifact. The P wave is still hidden in there. Okay? But something's happened, either the patient's shivering or somebody's moving the wires causing that artifact. And our rhythm is regularly regular. We've already identified that by looking at the P waves, but we know how to do it by measuring the R to R interval. So it's regularly regular. Okay, our PR interval looks to be normal. Our QRS width is obviously narrow. So from everything we've identified, we have a rate greater than 100. We have a P wave, a normal PR interval. There's only one P wave for every QRS complex, and that QRS complex is narrow. This is a sinus tachycardia. Sinus tachycardia. Let's look at the next one. I'm going to do this one a little quicker. Let's quickly identify the rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, let's see if it's regular really quick here. I'm going to measure here. I'm going to continue that measurement out. And it's pretty regular. Okay. Our P wave exists. You can see one here, 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 here. We have a normal PR interval. We have one P wave for every QRS complex. There's no extra P waves. Our PR interval is normal. Our QRS width is normal. This is a normal sinus rhythm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's right at 100 beats per minute. Normal sinus rhythm. All right, let's check out the next one here. Now this one looks a little funky, a little different. Let's see how we can quickly identify this. 1, 2, 3, 4, 5, 6, 7 QRS complexes on this 6-second strip. Has a rate of about 70. Okay. Let's see if it's regular. And obviously, you could already tell from looking at it that there is an irregularity, but everything is regular up until that point. Everything is regular up until that point. And then we have an irregularity. But what I want you to notice is that this space from here to here, if I double that between here, okay, we'll go right back into our rhythm. So what happened is right about here, I was going to draw it in there, right in there, we've had a dropped beat. So what did we call that before? It's not a sinus arrest because this continues the rhythm. We just had a single dropped beat and just continued. It's a sinus block. This is a sinus block. All right, let's look at the next one. Okay, obviously our rate looks to be slow. 1, 2, 3, 40 beats per minute. Okay, so our rate is slow. Our rhythm is regular. All right, if I map those, that should be a pretty consistent regular rhythm. All right, we have a P wave for every QRS complex. We have a normal PR interval. It looks like it's getting on the long point, but it's still normal. If you look at this last one, look at that last PR interval. It's right on the line there, and you can see that the QRS complex occurs before the next bold line. Our QRS width is narrow. This is a sinus bradycardia. Sinus bradycardia. Let's look at the next one. All right, this obviously is fast. You can see it right off the get-go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 QRS complexes. Okay, this is right about the 6-second strip, so this is close to 160 beats per minute. Okay, is it regular? That's very important, especially with these tachycardias, to identify if it's regular or not. Okay, and it does march out. It's also important to identify the P wave with these. And we do see a P wave. Now, it looks like it could be a notched T wave to you, doesn't it? But notched T waves typically don't exist. Okay, notched P waves might exist, but not notched T waves. So if you ever see that, where it looks like it's a double hump, that's typically a T wave and a P wave kind of going into each other. So those are your P waves right there. You have a normal PR interval, a normal QRS width. This is a sinus tachycardia. There's only a single P wave for every QRS complex, and we call that a sinus tachycardia. Let's take a look at this next one. Now again, this one looks a little different. It looks slow. It's about 50 beats per minute. Okay. And it's regular, except we have this irregularity here. And I want you to notice that even if I put a QRS complex in there, okay, even if I put a QRS complex right in there, that this does not continue the normal rhythm. All right? This is called a sinus arrest. Sinus arrest. All right? Now, when we start getting into all the other different types of arrhythmias, you're going to see that these are going to become harder to identify amongst everything else that you learn. But just remember that there's no P wave, there's no non-conducted P wave in here. Everything is missing, and it does not continue the normal rhythm. All right, let's quickly look at the next one. Well, this one's a little bit more difficult, isn't it? It looks fast, right? So let's see here. It's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 QRS complexes, so it's pretty dang fast. All right, it looks to be regular. Let's try to take a look here. It looks pretty regular, but again, it's important with these tachycardias to identify regularity. Try to get this here. Okay, yep, it's pretty regular. That's going to stay persistent throughout. Are there P waves present? Well, remember what I told you to, when you see these notches on the T waves, look at this T wave here. See a little dip? That's the beginning of the P wave, starting at that dip, and then you have the end of the P wave right here. All right, so those are P waves. Now, the PR interval, it's important to remember that the PR interval should not be prolonged, but we can't really identify it too well here because the beginning of the P wave is hidden. So there may be a prolonged PR interval. We're not sure. The QRS complex is narrow, okay? So for all intents and purposes, this can be called a sinus tachycardia. Now, if the PR interval does end up being prolonged, we would say it's a sinus tachycardia with a first-degree heart block. And we haven't talked about heart blocks yet, so I don't want to confuse you too much. So just keep that in the back of your brain until we start talking about those. All right, here's another one, and I'm not going to go through all the steps. I just want you to see that it's very fast. It is very regular. It's regularly regular. There's a P wave for every QRS complex. Okay, the QRS complex is narrow and the PR interval is normal. That's a sinus tachycardia. Again, moving along, this next one, as it comes up here. All right, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It's fast. It's narrow QRS complex. You have a P wave. There's no extra P waves. Your PR interval is normal, and it's a regular rhythm. It's also sinus tachycardia. All right, taking a look at this next one. This one looks a little bit different. Okay, it looks almost like it could be a normal sinus rhythm, right? You have a P wave. You have a narrow QRS complex, a normal PR interval, except it's not staying regular. So what do we call that? Sinus arrhythmia. Make sure you don't see any extra P waves. All right, you only have one P wave for every QRS complex, and it's a regular. It's a sinus arrhythmia. If everything is the same as a sinus rhythm except for the regularity, it's called sinus arrhythmia. Okay, let's take a look at another EKG as soon as it pops up. And here's another example where you have everything looks like a normal sinus rhythm. It just looks irregular. You'll notice that your R to R intervals are not staying consistent. They are all over the place. All right, they change with the respiratory pattern. Here's another example of sinus arrhythmia. All right, take a look at another example here. Again, this is sinus arrhythmia. It just looks like a normal sinus rhythm, except it's irregular. It's not regular. All right, so we just call that sinus arrhythmia. Here's another quick example. All right, you have P waves, QRS complexes, no extra P waves. All right, your PR interval stays consistent, and your QRS complex stays narrow. It's called sinus arrhythmia. And then just one final example. I'm trying to show you as many examples as possible so you can see that this looks different on different patients. It's not always going to look the same, and that's a hard concept to grasp about EKGs, that you don't have to look. A normal sinus rhythm on one patient will look completely different than a normal sinus rhythm on another patient, and that's just because there's all kinds of stuff at play there. You have the way the leads are set up, you have the size of the patient, you have the voltage of the heart, the depolarization that occurs, all kinds of different things may change the way it looks. And then you could be looking at it from different leads, which could also change the way it looks. So that was our very first chapter on actual EKG rhythms, and of course we started with the normal ones and we moved a little bit into the abnormal. Next, in the next chapter, chapter 8, we're going to talk about atrial rhythms. So if you want to go back, if this was too much for you, you could start going back by talking about the systematic approach in chapter 6. Okay, if you're ready to move on to the next chapter, click on that picture on the right and we'll move on to atrial rhythms. And as always, don't forget to subscribe to our channel.